June is National Athletic Therapy Month, and today's video is about a device that's commonly used by athletic therapists in the clinic, and that's an ultrasound unit. So before we get started, just so you know, this doesn't go internally in anyone, alright? So we just work on the outside structures, alright? So a little bit about the anatomy of an ultrasound unit is, which is this guy here, this is a high frequency generator, and so this has all the juice inside of it. And this cable here that's connected is connected into the applicator, which has the transducer, and inside is a synthetic crystal. All right, so that's the anatomy. Right. So the best way I figured out how to explain to my patients when you do an ultrasound for the first time with them in relation to tissue repair is relating it to the city of Winnipeg, more specifically the streets of Winnipeg and their potholes. So imagine the pothole is like getting a tear, and so both structures are damaged, and the city of Winnipeg, what they do is they patch it up. And so you can drive, but it's not the greatest, right? You gotta slow down, and you gotta worry about the little bump. And when it comes to your body, we get patched up by these matrix of fibers, and it's this mixed mash of connective tissue, and it just kind of fills that tear. And what it does is it allows you to be functional and continue on, but it kind of reduces the amount of range of motion that you have that's accessible to you. So you lose that potential. And so when we want to use the ultrasound unit along with manual therapy, that's kind of like the equivalent of the city of Winnipeg and, well, summer, which is also known as construction season. And so the city of Winnipeg, they go in and they kind of tear up everything. It's all controlled though, right? And they smooth it out, get rid of all those imperfections, and kind of make it nice and pretty so that you can drive no problem. So with the ultrasound unit, what happens there is the crystal in the sound head sends vibrations through the gel, which is just basically this guy here that's got water. It's pretty much water. And so what it does is that crystal sends vibrations through the gel into the tissue, and it just kind of shakes everything up, and it pushes out the bad stuff, all those adhesions, all the scar tissue, pushes it out into the circulatory system, and it helps to promote bringing in healthy nutrients to the area to promote healing and to help with that tissue repair. So in combination with manual therapy and the ultrasound unit, it's like resurfacing with the city of Winnipeg in the streets, and we make it that you get to have that potential, and you're able to use that full range of motion, and there's no limitations there, or next to none. All right, so thanks for watching, and I'll see you guys tomorrow. Okay.